painful bladder syndrome, or interstitial cystitis, is the name given for a condition where people suffer from very debilitating symptoms. These tend to be pain, which is centered around the bladder or the pelvic region, urgency, so urinary urgency, needing to go to the bathroom, and frequency. And some people can need to go to the bathroom up to 60 times in a 24-hour period. Now, this is different than, say, a condition such as cystitis. Cystitis can last for a number of days. There is an active infection, and this infection is normally bacterial. So there's an infection in the bladder or in the urinary tract, and the normal approach for that is antibiotics, which will resolve an active bacterial infection. With interstitial cystitis, it's very different because these symptoms can go on for literally years and there's no active infection present. But what is thought to be there is a damaged bladder lining. So because this bladder lining is injured in some way or defective, then the normal metabolites or impurities in the urine cause an inflammation in the bladder itself, and this gives rise to those symptoms of pain, urgency and frequency. Now, when there's inflammation present for a long period of time, the body has difficulty in healing that. And what's interesting about interstitial cystitis is that people rarely just have problems with their bladder. It's accompanied by all other kinds of conditions. And often people suffer from IBS as well, which is irritable bowel syndrome, or gut problems. And this can be bloating, wind, allergies, food sensitivities, and other things as well. And those with the condition also tend to have problems such as fibromyalgia, which is pain in the muscles and the joints, and they can get headaches and migraines. Obviously, for having an uncomfortable condition, severely uncomfortable condition for such a long period of time, they can get anxiety and depression and chronic fatigue as well. So this debilitating condition is normally tackled with orthodox medicine through pain relief, so giving painkillers, medication which reduces the frequency of urination, and anti-inflammatories. Now, this approach can be helpful for some people with the condition. However, my interest in the disorder and working with many patients with interstitial cystitis is how can we increase the body's ability to heal itself. So through my research, I've come up with a 7-step protocol or approach that can help not only reduce the symptoms with some people, but many of my patients have found that by following this approach, they can be relieved of symptoms for periods of time. So my 7-step protocol is, number 1, is looking at diet and nutrition. So what foods need to be avoided that are aggravating the bladder lining, and what drinks need to be avoided as well, and what foods need to be included in the diet in order to increase the body's ability to heal the bladder. What's interesting about people with interstitial cystitis is that it's not just the bladder wall that's affected, it seems to be a systemic condition. And frequently I find issues with the gut lining itself, so the actual digestive system. So often people have food sensitivities because the gut lining, the wall of the gut, is also affected. And this needs to be addressed in order to have some kind of relief of symptoms. So number 1 is food and drink. What needs to be avoided and what needs to be included. So number 2 is lifestyle. So what things need to be included in the lifestyle in order to promote healing? So that's related to sleep and exercise and other things. Because frequently I find with the laboratory tests I get back from patients with the condition, that their cortisol levels are often disturbed. So often when there's chronic inflammation in the body, the adrenals, the adrenal glands, which regulate stress, I suppose, in the body, are often not working to their full capacity. Number 3 is what environmental factors need to be considered. So certain things in our environment which seem to aggravate those with the condition, as well as other things like dental health. There's certain dental factors, things with the teeth, that can actually aggravate the condition. Number 4 is how can we promote detoxification? Those with a condition seem to have compromised detoxification pathways. So the body is naturally detoxifying all by itself. But sometimes these pathways the body uses in order to detoxify can be compromised, and this is really important to restore so the body can deal with its own metabolic toxins, and therefore the gut and the bladder can restore the important layers that need to be repaired. So gentle detoxification is vital to promote the body's ability to heal itself, but also this detoxification needs to be in such a way that doesn't aggravate the condition. So number 5 is how can we promote the repair of the bladder lining? And through my research, I've certainly seen a massive link between gut health and bladder health. So in order for the bladder to repair itself, the gut needs to be repaired as well. And there's certain factors there which are really vital. So this is to do with gut flora, so having the right levels of gut bacteria. And if they're present, then the gut can repair itself. And this can make repairing the bladder much more effective. Number 6 is trauma release. When someone is experiencing chronic pain and discomfort, the tissues in the pelvic area can become chronically tense, and there's ways of releasing this tension in order to improve blood flow, so healing's more likely to occur. So step number 7 is body work. What can we do to promote the healing in that area of the body? As I've mentioned, because there's chronic stress and tension in the pelvic area, there's certain exercises that can be done that actually promote blood flow to the pelvic region. Now, ordinarily, the kinds of exercises that are recommended for interstitial cystitis are pelvic floor exercises. However, what I found with working with people with that is that pelvic floor exercises seem to aggravate the condition. So there's other kinds of simple exercises and techniques that can be done that can increase blood flow, reduce tension, that doesn't aggravate the underlying condition. So with interstitial cystitis, there's many approaches that can be really helpful. Although it's a chronic and difficult condition to work with patients I've seen there's huge benefit in addressing nutrition, approaching detoxification and releasing trauma from the body. And I've seen that if people can implement really simple approaches, then the likelihood of increased quality of life is absolutely enormous. And it's just a matter of following a certain protocol in order to make that happen.